When a patient consults us for a rhinoplasty surgery, our examination essentially begins the moment we first see the patient. It starts the moment we first see them. And essentially, many things become clear in our minds. However, in any case, the patient, to assess whether there is an issue inside the nose or not, we need to conduct a detailed examination in our examination room. Here, we evaluate everything from the thickness of the nasal skin to the localization of the cartilage, the strength of the cartilage, whether there is a deviation problem inside the nose, or whether there are issues related to the size of the nasal turbinates. All of these must be assessed in detail. Consider that even the thickness of the nasal skin is very, very important in a rhinoplasty surgery. After fully identifying these, we are obliged to provide specific information regarding the patient. In rhinoplasty, we must explain to you in detail how we will proceed based on your examination findings and your skin structure. Of course, before the rhinoplasty surgery, we must seriously evaluate whether there is any health issue that could pose a risk for the patient receiving general anesthesia. We must thoroughly examine whether the patient smokes, uses alcohol, or has any existing allergic problems. And afterwards, especially sometimes our patients request us to do 3D work on their own pictures. They desire us to create simulations on three-dimensional computers. And sometimes our patients think this is not very reliable and want to see before and after case photos from patients we have previously operated on. Therefore, essentially what I trust more is to show my patients before and after pictures to explain my style. Basically, my style is based on naturalness. That is, let's perform a surgery so that the nose looks superb, but it's not easily understood that an aesthetic surgery has been undergone. Therefore, when showing before and after pictures, it is essential to pay close attention to the patient's facial expressions. Here, we also understand the patient's style and the type of nose they prefer. Therefore, as a result of a long and detailed conversation, we learn about the patient's expectations, style, and the nose structure they like. And we complete our pre-surgery plan. Before the surgery, it is crucial to listen to the patient's requests clearly and in detail. And we need to explain to the patient which of their expectations we can fulfill and to what extent, and which are not very realistic, in detail, and set our plan accordingly. After the surgery, patients especially need to apply ice diligently in the way we recommend for the first 2 to 3 days. The most fundamental point you need to know after this surgery is this. This surgery is painless. 95% of you will not feel any pain. Forget about pain, you won't even feel your nose. Therefore, for those concerned about pain, especially the pain issues or nasal packing problems they've heard like urban legends from relatives who had this surgery in the past, I want you to know that they no longer exist. The maximum time required for the swelling and bruising that may occur under the eyes after the surgery to subside is 7 to 10 days. Within 7 to 10 days, the swelling and bruising under your eyes will be completely gone. We used to use a plaster splint on the nose, but now we apply a thermoplastic splint. I think the plaster was very crude. Instead, I have been using only a thermoplastic splint for about 5 to 6 years. We will remove this thermoplastic splint within 5 to 7 days. And after removing it, we will apply a plaster bandage. After removing the plaster bandage, you will see your nose completely open within 10 to 14 days. When you remove this thermoplastic splint or plaster bandage, you will notice some swelling known as edema in your nose, which will decrease day by day. You will see it. The average time required for it to pass to a degree that you cannot see in the mirror or notice is 1 to 1.5 months. Of course, if we think it's necessary 2 weeks after the surgery, we will show you some massage techniques for your nose in a practical way, and teach you, and we will ask you to do them. This is not something we have to routinely apply to every patient. Therefore, if your current findings, for example, if your swelling is very excessive, we will guide you to help reduce this swelling a bit faster with massage. We will guide you. Therefore, on average, within 1 to 1.5 months, you will see that the swelling in your nose gradually decreases and disappears. During this process, you need to protect your nose from traumas and impacts. For patients who need to wear glasses or those who wear sunglasses, we will allow the use of glasses approximately 1.5 to 2 months later. The final shape of your nose, the time we need to wait to say that the healing is complete, even at a microscopic level, is approximately 5 to 6 months. After the surgery, if you follow our size instructions exactly, your application will be perfect. Aesthetic and magnificent nose that is so natural that no one will notice.